Katie Robertson Bailey. I'm a clinical project manager, registered nurse, and I work for Lincolnshire Community Health Services. Yeah, we've used Flo a lot in Lincolnshire and it's been really successful. Two key areas that we've used it in is diabetes and also for pressure sores in something we call Ambition 1. Every day we send up to 4 text messages from Flo to the patients and ask them for their blood glucose reading. So that's before breakfast, before lunch, before tea and before supper, bedtime. Then those readings are sent back to us and the specialist nurse can assess those readings and then contact the patient either by visiting or ringing and change their insulin amounts if they need to, especially if their levels were going low and dangerously low and potentially heading for a hospital admission. They'd advise them to reduce their insulin or stop their insulin for that day so that the patient was safe. They do, because the nurse can then see all the insulin, blood glucose levels on the screen. The nurse can assess. The patients don't need to come into clinic as regular. She doesn't have to go out to visit them as much. And the actual telephone consultation is lots quicker because before you'd be ringing your patient and saying, can you get your blood glucose book? Can you tell me your levels? Which is quite a long discussion on the telephone, whereas now she can see the levels and rings up and says, oh, everything's fine, what happened on Tuesday if there was a change, or change the insulin. So it's a quicker consultation even over the telephone. Any patients that are unstable with their diabetes for a long term, they are a huge risk of other blindness, all your extremity problems. So actually stabilising them from their blood glucose point of view is critical, really. And the patients we look after with our specialist nurses are only the really poorly ones. The others are managed with their GP or with a nurse at the GP practice, whereas these ones are unstable. So stabilising them is absolutely critical, really, for their long-term condition. Any patients that are high risk for developing pressure sores, and we use a tool called the Waterlow to score them. So if they hit the high risk on the Waterlow score, we then use Flo to help manage these patients. Previously, our nurses would have to go out every week, check their mattresses, check their pressure cushions, and then check their pressure sores. However, by using Florence to send text messages, we can ask, is your mattress or cushion inflated and safe? And we also give the literature, to help the patient manage that, or their carer. And then another text goes in on a Wednesday and says, have you any problems with your pressure areas? Are they red? Are they sore? And again, text message comes back from the patient or carer saying they're fine, or if they're not, an alert goes to the nurse, her mobile phone, and then they can go out and see the patient and make an assessment and change the care, different mattress, different equipment for them if needed. It's in their own home and also in residential and nursing homes, and it's very flexible. Carers, relatives, or the patient, send the text messages back to Florence. But it's reduced the visits for the nurses from every week to once a month now. So it's been a big impact for their caseload. I think it's really important for the patients to have the literature and a management plan. I really think it empowers self-management, self-awareness of their risk, because they're obviously high-risk patients, and I think it's very important for them. I think it's been really good that we've looked at the whole management of these patients, and they didn't used to have the information pack both on their mattresses and their cushions, that element, or on how to keep your skin clean, dry, well nourished. So I think it's developed the care in a great way, really. I think the beauty of Flo is the flexibility. I think one size doesn't fit all, so it can be so flexible around a type of patient, how the clinician, what the issues they feel they have with their caring for their patient. So I think it's just so flexible, so simple and adaptable. been very useful. I think what has happened for the patients is that they like us being more involved daily, 4 times a day. Sometimes because the staff only go out to visit the patients once a week, they sometimes are quite concerned psychologically, whereas when they have the link with Florence, regular feedback, and what for the diabetic patients they've loved is having on their iPhone all their blood glucose levels captured. So it's been a really good record for them as well. So that's a huge development for them, which we obviously didn't foresee as a benefit when we put it in, but they've really liked that.